England's National Health Service is warning not to give Pfizer and BioNTech's coronavirus vaccine to people with a history of severe allergic reactions. The warning comes after two healthcare workers who got the vaccine Tuesday had adverse reactions. Now, both had a history of allergic reactions and have recovered. CBS News Chief Washington correspondent Major Garrett spoke with Health and Human Services Secretary Alex Azar at a summit for the Milken Institute about those developments.
I'm sure that's something that our FDA will be asking about with Pfizer to learn what they have seen there in the United Kingdom. We'll talk to the MHRA, which is the regulatory body in the UK, I'm sure, to get any insights they have, and that will go into the FDA's process. That's why we take this carefully. That's why the FDA literally looks under the hood and checks every line of data. They don't take the company's submission at face value in terms of the data. Literally, what's taking time is they're going through every line of data on each patient, looking for any signal of adverse events that might have been missed, et cetera. And so they'll talk.
And Major joins me now from Washington. Hi there, Major. So Secretary Azar also spoke to you about the vaccine rollout and distribution here in the U.S. What's the latest?
Well, what the administration hopes is that the FDA panel tomorrow will give that emergency use authorization to the Pfizer vaccine, and within 24 to 36 hours after that, the first shipments will begin to roll out to those who are in the first two categories, Elaine, of use of the vaccine. Those are frontline healthcare workers and those who are in nursing homes or facilities like nursing homes who are elderly and have all of those vulnerabilities that we've come to know so much about the last 9 months of COVID-19. The numbers basically break down as follows: 20 million doses available by the end of this month, if all goes well. 50 million by the end of January, again, if all goes well. And what that means in the all goes well category is seamless distribution, seamless application at the pharmacy or doctor or hospital level, and no adverse reactions that alarm or so intimidate the public as to pulling back from willingness to accept the vaccine. They don't believe that's what's going to happen. They believe the data indicate that there are very minimal side effects, but this flag that we just talked about with those who have allergic reactions or a history of that is something that's new. And every new piece of data that comes up about reactions to this vaccine will, of course, provoke headlines, curiosity, and maybe some manner of concern. So the FDA, the Department of Health and Human Services, everyone associated with this knows that every single thing said about the speed of this distribution, the safety of the vaccine itself, and any side effects will be closely scrutinized and will be part of what is most important in the next 3 or 4 months, Elaine. Everyone I've talked to and the public health community and the scientific community agrees on this. The next 3 or 4 months is not only crucial in terms of manufacturing and distribution, but public acceptance. The public has to be willing to take this vaccine because short of 70% acceptance in this country, meaning 70% of the population being willing to take the vaccine, and if it's the Moderna or the Pfizer vaccine, that's 2 doses, not 1, but 2, and you've got to get both. Anything short of that 70% acceptance level is going to minimize the effectiveness of the vaccine because we will not, as a nation, achieve what is called herd immunity. So there's lots of good news out there about the vaccine, but there is a tremendous amount of work, not only logistically, but communications and acceptance of the vaccine.
So on that note of communications, there have been so many open questions, as you know, about communication between the outgoing and incoming administration. So Secretary Azar said earlier today that he has met with the Biden transition team and guaranteed a smooth transition to the Biden administration, even as the president again publicly refused to acknowledge his loss. What did he have to say about the meeting, which seems to have taken place a month after the election?
Yes, these meetings are ongoing, and I asked the Secretary, look, you had a summit at the White House yesterday about the vaccine, about the rollout, the mechanism, the logistics, all the things that your administration has put behind this, and will need to see work in 2021 for maximum effectiveness. Wasn't it a mistake not to have the Biden transition team there with you as you were having this conversation in public? He said, oh, no, that's not the venue. Well, of course it's the venue. The only reason it's not the venue is because President Trump didn't want the Biden transition team there in person, because if they were there, it would be the president himself acknowledging the underlying reality of the election. President-elect Biden won. He's going to be the 46th president, but President Trump simply doesn't want to recognize that, not on Twitter and not with his rhetoric, and certainly not with in-person attendance by the Biden transition team. That is a venue that would have, and I asked the secretary about this, wouldn't it have reinforced public confidence that this is going to be a seamless transition and that everything that the incoming Biden administration needs to know, it will know, and is working sort of hand in glove with this administration on the vaccine rollout? He said, no, we're doing lots of conversations. Everyone who needs to know does know and will know. So the secretary has to operate in a world of two realities. One is the reality of the necessity of this vaccine and the rollout working. The other reality, which isn't real at all, is that the President Trump doesn't want him to acknowledge full-blown cooperation with the Biden transition team unless when asked about it and forced to admit it. That's the position that this particular cabinet secretary, in the midst of a pandemic with hospitalizations and deaths rising, has to live in. It's a difficult place. I don't envy him.
I want to talk about that a little bit more in just a moment. But first, Major, the Department of Defense held a briefing earlier on the vaccine rollout for military personnel. Let's listen to some of that.
We anticipate that this will be approved using emergency use authorization, not a fully licensed FDA vaccination. And as such, the department's policy will be voluntary for everyone. So there's no ifs, ands, or buts about it. Doesn't matter. Voluntary for everyone.
So, Major, what is the thinking of making this vaccine voluntary when so many places like schools and universities require mandatory vaccinations for other diseases?
And businesses very well might require this vaccine as well. All that is to be determined. The Department of Defense has a policy, as I understand it, that unless it's a fully licensed vaccine, not given emergency use authorization, that you have to allow this room for voluntary decision-making within the military. I believe that is their policy. So it's consistent with that, as I understand it. But there's a larger construct here, Elaine. And I talked last week, you may remember, on my show, The Takeout, I had Dr. Anthony Fauci. And I said to him, do you believe, Dr. Fauci, it is best for this country to mandate acceptance of this vaccine, meaning everyone has to take it? He said, no, we don't need that. What we need is persuasion and willingness, volunteers to take it, and then, seeing that it works, spread that word to their friends and family and associates. He said that is the best way to create first and then build confidence in the vaccine, and from that point build the acceptance necessary to reach herd immunity. So the top infectious disease expert in this country, when I asked him about this 2 or 3 different ways last week, said no, mandates will not work. They'll do more harm than good. He said schools, colleges, businesses may do that, but at the government level, because of the sense that the government mandating something creates by itself a layer of resistance that we don't want, and we don't want to have to push through a voluntary program, whether it's the military or from the federal government's perspective, is the best way to go.
All right, Major, I know I said I had one more for you, but they're telling me I have to wrap. We will have you back on soon. Major Garrett, always wonderful to see you. Thank you so much, Major.
Sure.